Hello, 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 hello. So finally we are live. हम एक बार फिर से लाइव आ गए हैं. First of all, I would like to confirm that उम्मीद है मेरी आवाज़ आप सभी को सही से आ रही है. यदि ऐसा है तो एक बार आप लोग मुझे बता दें कमेंट के थ्रू ताकि हम लोग अपनी बातचीत को शुरू कर पाएं. जी हाँ, राइट साइड में कमेंट आ रहे हैं. गुड इवनिंग है जी, गुड इवनिंग है जी. डॉक्टर प्रियंका आपका स्वागत है. एंथनी आपका भी स्वागत है. साहबुद्दीन साहबुद्दीन आपका स्वागत. आई थिंक आप तो पुराने ही हमारे व्यूवर हैं. सभी को नमस्ते है जी, गुड इवनिंग है जी. मेरी आवाज़ ठीक से आ रही है और मेरा वीडियो आप सभी को सही से क्लियर है तो हम आज की बातचीत को शुरू करते हैं. जी हाँ, जी हाँ, जी हाँ. आप फिलहाल हमें देख रहे हैं फेसबुक, यूट्यूब और लिंक्डइन पे लाइव. और आपको जान के अच्छा लगेगा कि आज हम 148वें वेबिनार में आ गए हैं. हीलिंग फ्रॉम ट्रॉमा, हीलिंग फॉर ट्रॉमा. एंड इनके रिसोर्स पर्सन बहुत ही विशेष हैं. बिफोर वी स्टार्ट हम एक बार आवाज़ को चेक कर लें. कोई कमेंट मुझे मिला नहीं है. दिव्या आपका स्वागत है. एक बार आप कमेंट सर परफेक्ट. ओके ओके ओके. थैंक यू डॉक्टर प्रियंका. So my name is Raj Alampur. I am practicing as a psychologist and also working with military services. I am posted in Hisar Kent, and along with I am also working with family court as a family counselor and Rohtak, हिसार, जींद, हरियाणा और बहुत सारे ऐसे लोकेशंस हैं जहां हम लोग प्रैक्टिस करते हैं सिविलियन के लिए काउंसलिंग. मैं फिलहाल रोहतक सेंटर से बात कर रहा हूं और हम लोग रन करते हैं पर्सनैलिटी केयर फाउंडेशन, जो अभी तक इंडिया के 17 स्टेट्स में ऑफलाइन सेमिनार कर चुकी है. और आपको जान के अच्छा लगेगा कि ऑनलाइन यदि प्रेजेंस की बात करें तो इंडिया की हर सिटी के अलावा लगभग 20 से ज़्यादा कंट्री हैं जहां पर्सनैलिटी केयर फाउंडेशन के रिसोर्स पर्सन को सुना जाता है. जी हाँ, आपको जान के अच्छा लगेगा कि हम 148 फ्री वेबिनार ऑलरेडी 148वां आज हम पूरा करने जा रहे हैं. और आप सबको बताते हुए मुझे अच्छा लग रहा है कि इसकी शुरुआत बिल्कुल ऐसे हुई थी कि ये कैसे होगा, क्या होगा. डॉक्टर दिनेश सर की प्रेरणा से हमने इसे शुरू किया और धीरे धीरे आज हमारे बीच में लगभग 150 के आसपास हम वेबिनार जल्द ही पूरे कर देंगे. आप दिए गए डिस्क्रिप्शन से हमारी फ्री मेंबरशिप ले सकते हैं, जो कोई फीस नहीं है उसकी. और ये पूरे के पूरे दूसरे वेबिनार भी हमारे यूट्यूब चैनल पे 148 अभी भी फ्री ही हैं. आप चाहें तो उन्हें वहां जाके देख सकते हैं. आपके लिए लाइफ चेंजिंग एक्सपीरियंस होने वाला है. मैं ज़्यादा समय ना लेता हुआ एक बात को एड ऑन और कर देता हूं कि साथ साथ यदि आपको लगता है कि कोई रिसोर्स पर्सन जो आपकी नज़र में है, आप जानते हैं उन्हें, तो आप हमारे दिए गए डिस्क्रिप्शन से हेल्पलाइन नंबर से कनेक्ट करके हमें उनसे कनेक्ट करवा सकते हैं और हम जल्द ही उन्हें अगले सेशन के लिए इनवाइट करेंगे. आपको जान के बढ़िया लगेगा कि इन सारे वेबिनार का सर्टिफिकेट भी आप क्लेम कर सकते हैं. बस उसके लिए छोटी सी फीस हमने रखी, बिल्कुल नॉमिनल सी, मतलब 49 रुपीज़. साथ ही साथ आज के हमारे रिसोर्स पर्सन के बारे में मैं आपको इंट्रोड्यूस करना चाहूँगा. जी हाँ, धीरे धीरे हमारे साथ में लोग जुड़ रहे हैं. तो आज का हमारा टॉपिक वैसे तो अपने आप में ही, जब हमारे शरीर में कहीं बॉडी में कहीं चोट लग जाए, पैर के दर्द हो जाए, तो हम उस ट्रॉमा को, हम उस घटना को ठीक करना चाहते हैं. पर कई बार ऐसी चोट मन पे भी लगती है और मन की चोट को हम ट्रॉमा कह सकते हैं. और ट्रॉमा हीलिंग उसका एक प्रोसेस होता है जिसको इंट्रोड्यूस करने के लिए हमारे बीच में एक ऐसे रिसोर्स पर्सन हैं जो हमारे साथ साउथ से कनेक्ट हो रहे हैं. मैं सबसे रिक्वेस्ट करूंगा कि वो मिक्स लैंग्वेज रखें तो ज़्यादा बेटर रहेगा. लेकिन उससे पहले हमारी ऑडियंस एक प्यारा सा कमेंट लिख के वेलकम उनका करेगी. उनका स्वागत हम करना चाहेंगे हमारे बीच में, जो आज के हमारे रिसोर्स पर्सन हैं. जी हाँ, डॉक्टर श्याम कुमार सर हमारे बीच में आ गए हैं. डॉक्टर पी श्याम कुमार सर, आप एक चित्त धारा काउंसलिंग एंड माइंड एम्पावरमेंट जो बेंगलोर में काम करती है, वहाँ के फाउंडर मेंबर हैं. और मैं अपनी बातचीत को शुरू करूं उससे पहले ही मैं डॉक्टर साहब का बहुत 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 थैंक यू पे करना चाहूँगा। उन्होंने पर्सनैलिटी केयर फाउंडेशन के साथ दोबारा से समय देने के लिए, दोबारा से हमारे साथ जुड़ने के लिए राज़ी हुए और मुझे काफ़ी अच्छा लगता है। वो एक काउंसलिंग साइकोलॉजिस्ट हैं, साइकोथेरेपिस्ट भी हैं और सॉरी, और लगभग 1 नहीं, 2 नहीं, 10 नहीं बल्कि 14 ईयर का उनका एक्सपीरियंस। कहने में 14 साल लिखने में 1 सेकंड लगता है, बट एक्चुअल में 14 साल का एक्सपीरियंस मायने रखता है। साथ ही साथ वो एक रजिस्टर्ड क्लिनिकल हिप्नोथेरेपिस्ट, जो जर्नल हिप्नोथेरेपी काउंसिल है यूके में, वहाँ से सर्टिफाइड भी हैं। साथ-साथ में क्लिनिकल हिप्नोथेरेपिस्ट सर्टिफाइड है विद आईएचसी यूएसए, अलोंग विद आप लोग जानते हैं बहुत सारी ट्रेनिंग के, बहुत सारी काउंसलिंग के, बहुत सारी इंडिविजुअल प्रैक्टिस के, रिलेशनशिप केस के, मेंटल हेल्थ इश्यूज के, इन बहुत सारी चीज़ों को लेके सर काम कर रहे हैं। गवर्नमेंट की एनसीएस नेशनल करियर सर्विसेज, जो मिनिस्ट्री ऑफ गवर्नमेंट के, पहले ये लेबर डिपार्टमेंट के अंडर आता था, एक सेंट्रल गवर्नमेंट का एक प्रोजेक्ट है, वहाँ भी सर रजिस्टर्ड काउंसलर हैं। मैं भी उनके साथ में जुड़ा हुआ हूँ, तो मुझे ध्यान आया कि एनसीएस काफ़ी अच्छा पोर्टल है जो गवर्नमेंट की तरफ से चल रहा है। और साथ साथ में वो सोसाइटी ऑफ क्लिनिकल एंड एक्सपेरिमेंटल हिप्नोसिस के भी लाइफ मेंबर है, साथ में कैलिफोर्निया हिप्नोसिस की हिप्नोसिस इंस्टीट्यूट के भी लाइफ मेंबर है, साथ साथ में भारतीय काउंसलिंग साइकोलॉजी के भी लाइफ मेंबर हैं, और मेंबर ऑफ अमेरिकन साइकोलॉजिकल एसोसिएशन, वन ऑफ द प्रेस्टिजियस सोसाइटी एंड एसोसिएशन इन अक्रॉस द वर्ल्ड, आई थिंक उनके भी मेंबर हैं, और एपीसीटी केरला के भी डॉक्टर साहब लाइफ मेंबर है। वैसे तो इनका इंट्रोडक्शन इतने 14 साल की बात एक स्लाइड में लिखना काफ़ी टफ जॉब है, लेकिन मैंने थोड़ा सा सर के बारे में आइडिया दिया है, जिन्हें आप आज सुनने वाले हैं। वो बेहतरीन ही एक्सपीरियंस के साथ अपने जीवन को बिता रहे हैं। मैं हमेशा मानता हूँ 1 घंटा किसी एक्सपीरियंस आदमी के साथ बात करना और एक पूरी किताब को पढ़ना बिल्कुल बराबर बात होती है। ज़्यादा समय ना लेता हुआ मैं सीधा हैंड ओवर करना चाहूँगा डॉक्टर साहब को। नाउ इट्स ओवर टू यू डॉक्टर साहब, थैंक यू सो मच।
Thank you, Mr. Raj, and good evening, all. So, I hope that everybody join here. And today, anyway, so we are going to discuss an important topic. And I feel that maybe a lot of psychologists may be here, and even common people also will be here, I think. So anyway, trauma is same for everybody. So whether it is psychologist or any common people or something like that. But anyway, we are going to discuss some trauma healing therapeutical approach and all these things. So this session will be in most of the time it will be in English, but in between, yes, I can even speak in Hindi also. But even though I am not very much familiar with Hindi, maybe some mistakes will be there. I hope that you will will bear with me for that matter. But at present, already Raj introduced me. I am currently from Bangalore. My counseling center is in Bangalore, and these are the some of the credentials. I have a lot of other credentials also with me, and basically I am practicing more in clinical hypnotherapy, and I am basically an NLP master practitioner also, and doing a lot of CBT, DBT, and mindfulness based therapy. And almost every cases like a trauma, including trauma, and most of the cases I am taking. And along with that, I am actually doing psychometric assessment and career counseling for students and professionals also, because I am registered with the Government of India, NCS, National Career Service, Government of India. And moreover, a lot of other diagnostics also I am doing with a lot of other platform like clinical diagnosis and all these things, sometimes to understand the personality disorder as per the DSM-5 and all these things. So this is my brief work in Bangalore in this center, and I'm a corporate trainer, and I'm going for a lot of training program and workshop also. I am conducting a lot of workshop, virtual and offline and online workshop. And one of my clinical hypnotherapy foundation course is approved by, accredited by International Hypnosis Association USA. And almost I conducted now 5 batches of that course. Regularly I used to conduct that course also, along with some inner child healing course, and as well as even trauma healing EMDR therapy. I conducted 6 batches of that training. That also I am doing. So these are the some of the things what I want to tell you about this, about myself. Okay, now we can straight away start our topic. Okay, next slide. Yes. So basically, when we say trauma, trauma is an emotional response actually, basically. So everybody, almost it's an analysis says that almost every people, everybody experience either one or two or different intensity of trauma in our life, because that is our life, that is our society, that is our parenting. So it's a common thing, because but how intense it is, how you are carrying the trauma, how you are carrying the pain, and that is actually matters a lot. So trauma is not just about what happened to a person, it is about how the nervous system experienced and stored what happened, or what the event, or what is the memory, or what is the associated pain of that event. That is very important. And trauma usually occurs when a person experiences something too frightening, painful, or overwhelming, and their system cannot process it fully. Means it should not be a major incident or event. Even very minor incident can also cause trauma in your mind and body. But if it is accumulated, it can become a chronic traumatic experience. So, but anyway, all type of trauma has to be healed or diluted from your mind. Otherwise, in your lifelong, you will experience a lot of emotional as well as physical problems. So that is why trauma healing is very important. Even though you feel that trauma is no, I don't have anything, oh, I am okay with that. Yes, of course. Here we have to understand one thing: the experience of trauma, the intensity of trauma experienced by different person will be different. For example, the same amount of trauma, two different people will experience in a different way. Why it is like that? Because there are a lot of reason for that. Because the coping mechanism what you are adapting, or the family support what you are getting, or there are some genetic factor also, and the coping mechanism what you are following, everything depends upon how you are experiencing the trauma. That means there are certain people, they can heal their trauma by their own to some extent. That is why they will not feel a traumatic pain. But when it is goes to a very high level, or when we can say a complex trauma, then it will be a difficult, and then it needs a healing therapy or medication or therapy, psychotherapy. And when I say medication, to be frankly speaking, trauma healing is taking place with the psychotherapy in a better way than a medicine. But normally, maybe a dual treatment may be needed to stabilize initially for you. So that is basically the, because trauma treatment start with the self care. You care your body and mind with a lot of exercise, lot of activity, lot of meditation, lot of mindfulness. Then you can heal your trauma by your own. So that is also a method for trauma. Means, so whenever you talk about trauma, so everybody afraid of that. It's not like that. Every human beings experiencing, but most of the time we know that in our childhood what we are experiencing, it will make a chronic trauma for you. So it need a healing technique or healing therapy. So next slide, please. Yeah. So any disturbing experience that result in significant fear, helplessness, dissociation, confusion, or other disruptive feelings intense enough to have a long lasting negative effect on a person's attitudes, behavior, and other aspects of functioning. This is basically trauma. So it is actually, even a simple thought rumination can also cause pain, but that time what will happen, the trigger will be more, because if something hiding on your unconscious or subconscious mind, some event or pain, when you are having a lot of anxiety or negative thought, so you will get the trigger. So again it will aggravate you, and you will be in a trouble or emotional trouble situation. So that is the thing. That is why the anxiety also, we can say the anxiety is a byproduct of trauma. And the trauma can also cause anxiety. Anxiety can also cause little bit triggering of the trauma also. That is the thing. So negative. That is why in trauma healing there is a CBT technique also involved. because CBT, trauma focused CBT therapy is for trauma healing. We will see that. And traumatic events include those caused by human behavior, example rape, war, this industrial accident, as well as by nature also, earthquakes and often challenges, and all this will cause trauma for a human being. And everything can be do at different intensity, because measure will be different, but how it is, but it can accumulate, it can aggravate, and it can grow from your mind and body, then you will experience. But at the same time, you will be daily focusing on your exercise and self-care, self-reliance, meditation, and all this, maybe it can go diluted also. So that is the thing for trauma healing. So next slide. Next slide, please. Yeah. There are three main types of trauma. What we already I told, acute trauma. It can be because of a single event or dangerous event. It can be anything. So immediately you can go into little bit fright and flight mode, and it will cause some trauma or pain inside you. And it can accumulate also. It can also imprint in your mind and body also. Why I am always saying mind and body? Because trauma is most probably stored in the body and not majorly in the mind. That is why normally initial psychology theory says that your trauma is in your mind, but later and later the neuroscience says that the trauma is mainly stored in your body. So that is why normally the trauma affect your body as well as your mind. Then chronic trauma mean this from repeated and prolonged exposure to highly stressful events. Example include cases of child abuse, bullying, or domestic violence. Domestic violence and even the negative parenting, one of the major reasons where childhood trauma happens. So that is actually aggravating, and it is accumulating, and it's maybe a prolonged exposure. That is chronic trauma. Then complex trauma. This results from exposure to multiple traumatic events, not only one. There are a lot of traumatic events happen in your life, so it will be a complex trauma. Then complex PTSD also will come, post-traumatic stress disorder. And the secondary trauma, or otherwise vicarious trauma, is another type that may occur. In this case, a person develops trauma symptoms due to close contact with someone who has experienced a traumatic event. For example, a counselors can normally come in this type of, because you are always interacting with the people with a lot of pain and trauma and all these things, so you will be entering into a vicarious trauma. If you are not taking care of yourself, if you are not able to cleansing your mind regularly, then you will be in trouble with the vicarious trauma maybe. And another reason is, in a family, if somebody is having continuous traumatic experience, so those who are closely associated with that person will also get a secondary trauma because of that. So that is also known as secondary trauma or vicarious trauma. This also need to be attended. This also need to be healed. See these thing. Then three types of trauma. Then next slide. So there are, in this slide you can see there are types of trauma again. Adverse childhood experiences, and now you can domestic violence, drugs and alcohol abuse, physical abuse and emotional abuse, shouting, blaming, criticizing, beating, and all this is sexual abuse basically, and sexual abuse and neglect also, loss due to separation, because in the family, if a divorced family, the child normally, or children normally experience a lot of separation anxiety, which will leads to trauma also. And then a lot of things like that. This is one of the adverse effect or adverse childhood experience. Then type 1 trauma, some accident, car accident, or single or occurrence of sexual assault, terrorist incident, and physical assault, everything can be cause a trauma. That is normally type 1 trauma. And type 2 trauma, multiple traumatic events over a period of time, continuously harassing, continuously abusing, and continuously exposed to a war or any natural calamity or something like that, that will also create a trauma in the mind. It is a type of chronic trauma. Then complex trauma, repeated, often multiple form of abuse, physical, sexual, and or emotional, can arise in the context of extreme neglect, even the abandonment, rejection, and all this is because in a family also, if the partners are now avoiding each other, or not giving proper emotional support and love and affection, and continuous thought rumination, continuous pain taking inside, that will also cause a trauma. That is a lot of family cases. When we go for family therapy, family counseling, there are a lot of traumatic experience we normally come across as psychologists. So complex trauma, and these are the types of, some of the types of the trauma or time of trauma where you get it to in your life. So next slide, please. Yeah, how trauma stored. Because as I told you, psychology believed trauma was mostly a memory stored in the mind. To some extent, it is correct. But modern neuroscience has shown that trauma is also stored in the body and nervous system. When a traumatic event happen, the body goes into survival mode. So you know that the survival mode, the nervous system activates one of three survival responses: fight, trying to defend or attack; flight, trying to escape; freeze, shutting down when escape feels impossible. If the event passes and the body safely processes the experience, the nervous system returns to normal. But when the experience is too overwhelming or too painful, the nervous system may remain stuck in survival mode. So then that will be continuing in your body. So this means the person may continue feeling danger even when they are safe. That is why sometimes when you feel that the event is already finished, but you are still getting a pain or getting a memory or haunting memory inside you. Because a lot of people, because a lot of people came to me because in their childhood they observed, maybe they witnessed a horrific accident or any accident type, and the same event, same memory repeatedly coming in their mind when they are exposed little bit in similar situations. So this is basically already it is stored in the memory is stored, and the pain is already associated with that. So in that case, if you are not completely healing, or if you are not detaching that pain associated with that memory, then this will create a lot of emotional dysregulation and a lot of painful situations for your for this victim. So this is actually the, that is why normally trauma is stored in the body, it is saying. That is why in one of the trauma healing therapy, somatic psychotherapy normally experience, because somatic psychotherapy means with your body activation or with your body movement. Somatic psychotherapy normally accept in the form of healing of trauma, basically. That because body is releasing that. That is why. So mind, yes, accordingly, then you know that the body and mind is very closely related. So whatever you have in your body, it will definitely reflect in your mind. Whatever in your mind, it will reflect on the body. But then it is closely integrated. But everything is like that. But moreover, when you release that pain, when you relieve that pain from your body, and you will get a relief in your mind also. That is why somatic psychotherapy is normally one of the trauma healing method normally adapting by psychotherapists. So next slide. Then trauma effect. So there are a lot of effect you can see when you have a trauma. What are the things? Even depression, anxiety disorder, addiction can happen, relationship difficulties, or chronic stress, emotional dysregulation. Because depression, see, basically, according to American Psychiatry Association, the major three reasons they identified as the cause of depression is, one is actually in your body, the hormones, pleasure hormones like serotonin, dopamine, GABA, and oxytocin, whatever it may be, it is not properly generating or not it is not properly distributing. That is one reason. And the second reason is, even though your body generates enough pleasure hormones, it is not properly functioning in your neuron. That is malfunction of your pleasure hormones or the chemicals or the messengers. The third reason they identified, some of the traumatic experience, traumatic event. If some trauma is there in your mind, then you can enter into, or you will be going into in the depression. Then when you go into that, can even go into depression, and that can go into borderline personality disorder, and even everything can be mixed each other, and you will be in trouble. So then a lot of anxiety disorder can cause with the traumatic experiences, traumatic memory. Because anxiety, you can say anxiety can cause with the negative or thought rumination, lot of negative thinking. But this negative thinking also can be connected, or it can be linked with your traumatic experience also. Then you will be enter into a traumatic, a highly anxiety disorder. Then for the coping mechanism, sometimes you will go for some addiction, either maybe alcoholic or smoking or porn video or gambling or whatever. So a lot of people, to coping with that, they will select a wrong way of coping mechanism, so that can lead to an addiction also. And as I told you, there are a lot of relationship difficulties, because there are schemas. The schemas, wrong or negative schemas in your mind, or anybody, either husband or wife, that can always create lot of misunderstanding and lot of emotional disturbances, and even lot of impulses can come, and even lot of suicide is happening because of that also. So this is again the trauma effect. Then chronic stress also, I already told you, because the stress is continuous for you because of this. Then lot of emotional dysregulation will happen because of the traumatic memory, because your amygdala will always reactive, and always you will go in a emotional dysregulation if you are not taking care to control your emotions. So do some technique, as I told you, self care, exercise, mindfulness, something like that, you will be in trouble with your traumatic experiences. So this is trauma effect, basically psychological part. There are a lot of things, but only I listed. And the next slide, please. Next slide, please. Yeah. Then trauma affect physical. When you have, okay, you people know that when you have extreme anxiety, stress and trauma, headache, continuous headache, and even it can lead to, even sometimes sometimes you will mistake it as a migraine, but it is. And there are a lot of digestive symptoms. Basically, the IBS, irritable bowel syndrome is basically related to your anxiety and trauma also. It cannot be treated with the medicine, it can only maintain. So there are a lot of digestive symptoms are because your gut therapy. So because basically your gut is related to your hormone, serotonin and generation, then this is again imbalance your body, and you will get a lot of digestive symptoms, constipation, IBS and all this is with, even that is also an effect of even anxiety and trauma. And fatigue, because tiredness, always you feel no energy, you are always lethargic, you are always no need to do anything, your mood off, something like that. That is. Then racing heart, always whenever anxiety comes, your panic and all this is raising heartbeat and everything. Then sweating and shivering and all these things, actually physical symptom of trauma. So trauma causes a lot of psychological as well as physical problems in your body and in your mind. So next slide, please. Okay. Then goal of trauma, we are not going to explain too much about the trauma. We are connecting with the trauma therapies. Basically, we are to. So goal of trauma therapy is what? The main goal of trauma therapy is not just talking about the past. The real goal is to help the nervous system feel safe again. So you will release that, or you will release the pain associated with that trauma. That is the goal of because you again and again talking about the past and bringing, but you have to understand one thing: almost every trauma healing therapy will work. First, you will bring that trauma in the mind, then you will dilute it. Okay, there are certain other thing also there, but even that most of the therapies, because without experiencing the trauma, you cannot heal the trauma. That is why normally during the trauma healing, the client will go very emotional, where a lot of maybe screaming, crying, and all this will happen, because they will really experience it in their mind, in their subconscious, unconscious mind. They will bring it up. Then you will help them to dilute, and they will help to just dilute the pain and all this. That is the normal trauma healing therapy. So trauma therapy help a person process unresolved memories, because of the trauma effect, there are a lot of memories imprinted in your unconscious mind, or even we can say subconscious mind also. This is lying there as unresolved one, so you have to resolve it. So the process of resolving is happened during the trauma therapy, and release stored emotional tension. Along with that, you will release the emotional burden, emotional tension, and regulate the nervous system. And you will give a lot of grounding mechanism, lot of meditation part, lot of other thing along with that. Then they will be very safe and secure in that. So then rebuild a sense of safety and control, and develop healthier emotional response. So this is basically the goal of trauma therapy. So not only, because why I am saying that talking therapy Even though Sigmund Freud psychodynamic or psychoanalytic therapy says that by talking therapy, yes, of course, this is also a therapy. Even to some extent, you can get it out, or the client can maybe dilute the event because it come up and it will be going. But even then, only talking therapy may be not helpful in the case of a trauma therapy part. So is need really a trauma therapy technique also. You have to, even psychologists or psychotherapists, you have to apply that trauma healing technique also. Then they will completely feel the safe, and emotional response will be safe and secure, and they will feel like that. So that is the goal of a trauma therapy. And next slide, please. Yeah. Then we will say what are the major trauma therapies. We are not explaining in detail everything, but I will mention some of the therapies normally using. And in that, first therapy normally is a very effective therapy internationally and nationally using also, that is EMDR therapy, eye movement desensitization and reprocessing. EMDR therapy, because it is a very good technique for trauma healing purpose. So what is the basic of this? This therapy designed to help a person become less sensitive to traumatic memories by recalling and reliving the experience in a safe therapeutic environment. So during an EMDR session, the therapist uses bilateral stimulation. Bilateral stimulation means two different activity together. One may be an eye movements, and then you bring the memory. See, the brain cannot store simultaneously your memory. The brain, when you tell the client to bring the memory or bring the event and bring it in your mind, then you will give another moment like eye moment, or even butterfly hug, or like tapping on your body and all the, then that needs more memory than this one. So automatically your traumatic memory dilution happens. That is why normally bilateral stimulation such as eye movements, sounds, or tapping, this process helps the brain reprocess the traumatic memory, which can reduce the emotional intensity and distress associated with the trauma. This is actually EMDR therapy. This is an 8 phases therapy. There are 8 phases for that, different phases, because I normally conduct a workshop in EMDR. Already I told you 5 batch, 6 batch I did, and now maybe in sometimes I plan to do it in a basic things, how to apply the EMDR in the client. That's all, because in the major complete advanced therapy and everything you can learn from internationally also, or even what is that EMDR Institute of India is offering courses and all this, but it is slightly expensive also. You can think about that. So typically around 6 to 20 sessions depending upon the trauma. Depending upon the trauma, you can 6 session also okay. Sometimes some clients will come very safe within 5 session also, and otherwise you have to go minimum. I found that even some 10 or 12 session, most of the trauma can be healed with this technique. That is a EMDR therapy. And the next one is prolonged exposure therapy. Throughout the treatment, the therapist uses systematic desensitization techniques, gradually exposing the client into trauma triggers in a safe way. Over time, this helps reduce their symptoms and promotes healing. The therapist will teach the client relaxation and grounding technique to use when exposed to the trauma triggers. So the therapist will teach the client so how they can go to a relaxation technique, how they can go to a grounding technique. So you will do slowly, very systematic way. You will bring the trauma. All of a sudden you cannot bring, because if it is a severe trauma, it will be very difficult. So when I was doing the therapy for a client, actually because for a half an hour, I was in a out of control with that client, because she's completely screaming and she's not sitting in one place. She is always rounding in the room, and all these things happened in the, but I know that this has happened because it's a severe trauma. So I give time enough to settle down. Then finally only she came into that level, and then we continue like so. It also happens in a trauma healing. But you as a therapist, you should not be panicked. You should not be worried about that. It's not because trauma when you experience, it can go little worse also in the therapy. So normally this technique around 8 to 15 sessions needed for this prolonged exposure therapy. Okay, so next slide. Yeah. Then cognitive behavior therapy, as I already told you, CBT, because the main concept is because emotions and feeling. So emotions and feeling, then it will change the behavior also. So the behavior of the victim, depending upon their emotions, depending upon their thinking, depending upon the, so like that you will just teach the client how they will because reframe their biased thought, or how they can challenge their negative thought into positive. Then you can help them to slowly to come out from this. Behavior therapy also, CBT also using in trauma healing, and it is need normally 12 to 20 sessions depending upon the trauma. And then cognitive processing therapy is one of the therapy also. It's also again related to psychoeducation. First of all, you will educate the client about the trauma, and content of the trauma, and intensity of the trauma, scale of the trauma, experience of the trauma, and how your mind works, and all this is, you will give a psychoeducation. Then slowly you will teach them to cognitive restructuring. So again, you can restructure and evaluate, then you can make more clarity in their mind. That is cognitive processing therapy. So typically around 12 sessions, typically around 12 sessions needed. Even sometimes it can go more also, 12 or 15, or depending upon the trauma. Next slide. This is trauma focused CBT. That is trauma focused CBT. Again, TFCBT focuses on educating clients about trauma and teaches them relaxation and coping skills to manage symptoms. Clients share and process their trauma story, helping them integrate it into the life history, because it is little bit like a psychodynamic or something like that, because you will educate them, because then with a lot of positive beliefs, negative beliefs, how they think, and you will educate them really what is actually trauma, how it is affecting your body, how it is affecting your mind, how you can cope up, what are the things you can do, like that. And you can set a goal for them slowly. So like that, you can restructure their thought process and restructure their emotion, and you can make them more emotional balance for that matter. Then this is 12 to 25 sessions normally takes. Then the somatic therapy, as I told you, in somatic therapy, clients are guided to become more aware of their bodily sensation and how these might be linked to past traumatic experiences. Using techniques like breath work, meditation, and guided imagery, client learn to release the trauma from their bodies. This is somatic psychotherapy, can use in any way. Even when you can say that like EFT, TFT, emotional freedom tapping technique, and thought field tapping, because I am a master practitioner of that also. And otherwise, the yoga therapy, yoga can also help in this way, and little bit good breathing exercise. Breathing exercise can help to release, and because here all you will aware the body sensation, and you can guide them to dilute that body sensation with their thought, with their breathing, with their imagination. So this is actually, somatic therapy is a very good therapy for trauma healing. It is a very effective also basically. So first part, when you come, so first part you have to educate your client and give some somatic exercises for them, some breath work or breath work, or some body exercise and all this. That is why normally people suggest gym and swimming and walking, gardening, sports activity. All these things will help you to release the toxic traumatic events or memory from your body, and you will get a relief out of that. Typically it will take 8 to 20 sessions, but it can change also depending upon the nature of the trauma. Yes. Now next slide. Yeah. Then, as psychologists normally know, dialectical behavior therapy, DBT. DBT, even though initially it is for borderline personality disorder, it is also can be used for even like anxiety. Also, it can use for trauma healing also, because here the main skill, you will teach the main skill like mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. A lot of journaling, a lot of affirmations, and a lot of exercises, a lot of mindfulness based technique, even mindfulness based cognitive therapy like meditation, body scan meditation. Because last time I did a free meditation class, I gave the technique for MBCT, mindfulness based cognitive therapy. It is available in my YouTube also. So that and all will help in this case in the dialectical behavior therapy. and 6 to 12 months it will take, because dialectical behavior therapy will take a little long time to heal the trauma. That is why normally DBT psychotherapist normally is not doing it, because maybe I don't know, that depending upon your experience, if you are well good in DBT technique, you can use it. But normally I didn't find most of the therapists are using DBT for trauma healing. Other than that, they are using some other technique. And clinical hypnotherapy, as I told you, this therapy works by helping a person to engage more deeply with their subconscious through a variety of techniques. And then the hypnotherapist can help the person resolve traumatic memories by reprogramming the responses. So, hypnotherapy is often used alongside other therapeutic approaches, incorporating other post hypnotic work. When you do hypnotherapy, definitely you have to give some post hypnotic exercise also, post hypnotic work also, or post hypnotic affirmations, some exercise you have to give them to strengthen that thing. So hypnotherapy is one of the best therapy. You can use it for trauma healing. Basically it will get a wonderful relief and recovery on that, because basically the research says that the recovery percentage of hypnotherapy is almost 90%. 90%, it is 80 to 90% all therapy. Because anyway, even for the anxiety, for the any other thing, and hypnotherapy can be, because even maybe typically 5 to 10 session, even below, see, 3 or 4 session also. Then after that you will record some audio, some help self hypnosis technique you can record and give to them practice, so they can release their trauma from the subconscious or unconscious mind. So hypnotherapy was very well. And along with that, if you mix hypnotherapy with the NLP, so there is a technique like that. This sometimes it is called as brief psychotherapy. So NLP plus hypnotherapy together is one of the best therapy to heal that trauma also, because really they will experience, and then they will really feel it, and they will mask it or fade it in that such a way that it will release from their unconscious or subconscious mind. So hypnotherapy is one of the best therapy we can say for trauma healing also. Even though EMDR and hypnotherapy is most of the people are using, and even CBT also using. I am not saying that it is not using, but sometimes if you are experiencing that, if you are experiencing hypnotherapy, or if you are experiencing in EMDR therapy, you can directly go with that, even though it takes some time. So definitely it will be a good therapeutical approach for trauma healing. And next slide, please. Yeah. So, but normally, as I told you, all the psychotherapists normally use a integrated approach, because normally therapists will adopt an integrated approach. That means they will use multiple methods of trauma healing depending upon the complexity of the trauma. That's what I am telling. See, I am using hypnotherapy, I am using EMDR also. Even certain cases, I am using DBT also and CBT also. So, depending upon the intensity, depending upon the type of the trauma, depending upon the complexity of the trauma, you can suggest what are the therapy technique you can integrate and use. Maybe you can use it in a different way, not go for only one. So maybe that may not be working, so you can go. And I think most of the psychotherapists will go integrated approach in most of the treatment, because they will use one or two different technique to heal the trauma or the negative emotions and all this. This is actually not the integrated approach for that. Yes. Now next slide, please. I think it is almost finished now. Yes, very good. So this much only about the trauma, which is very simple, very, because I just want to bring an awareness only, because really the complex treatment has to be go in a complex way only. It is not, see, as I am talking now very simply, but the trauma healing is not as so simple as we talk. That you have to understand, because it takes some time, and because always mind reprogramming takes some time, and like that only slowly it can heal. And it can 100% it can, yes, it can heal, because I have a lot of experience with me. A lot of client completely come out from this, and a lot of experience I got. That's what I'm telling. It is possible. It's not like that. Definitely you can do that. So this much only. So thank you very much for almost joining with me in this evening. And now you want to something, maybe anybody have anything, any question or any doubt or something like that, even whatever possible way I can explain to you now. Yes, Raj, over to you.
So I think it was totally informative, insightful session, और and also like a compact की बहुत सारी थेरेपी के बारे में, और लास्ट में इंटीग्रेशन का जो कॉन्सेप्ट था कि बहुत सारे थेरेपिस्ट लिखते हैं कि मैं सीबीटी प्रैक्टिशनर हूँ, मैं ये आईपीटी करता हूँ, एसएलबीटी करता हूँ। तो आपने बहुत ही शानदार बात बताई कि बहुत सारी थेरेपीज का कुछ पार्ट हर कुछ तरीके के डिसऑर्डर में काम आता है, और कोई ज़रूरी नहीं कि एक ही थेरेपी को फोकस करें। मुझे काफ़ी इंसाइटफुल लगा, मुझे काफ़ी इन्फॉर्मेटिव भी लगा। ऑडियंस से मैं जानना चाहूँगा कि उनको ये सेशन कैसा गया। यहाँ पे अल्का साइकोलॉजी, वेरी इन्फॉर्मेटिव सेशन सर, सो थैंक यू सो मच टू ऑल। सेशन कैसा लगा ये आप बता सकते हैं, और साथ ही साथ ये भी बता सकते हैं कि आप ट्रॉमा से रिलेटेड कोई सवाल पूछना चाहें, कोई बात दिमाग में रखना चाहें, तो क्या आप पूछ सकते हैं। आप अपना सवाल कमेंट कर सकते हैं। जी हाँ, थैंक यू सो मच। सभी को बहुत बहुत शुक्रिया। आप बता सकते हैं यदि इस तरीके के टॉपिक से रिलेटेड कुछ सवाल हैं। जी
No,
हाँ,
what is that?
देख
Yeah.
सक जी, हम देख रहे हैं सर, कोई सवाल के लिए वेट कर रहे हैं। बाकी सेशन मुझे बहुत ही अच्छा लगा, बहुत ही बढ़िया लगा। मुझे मेरे दिमाग में थोड़े बहुत सवाल तो ज़रूर आ रहे हैं।
Yeah, there is actually, I saw one message here because when it comes to EMDR therapy, you mentioned about a bilateral stimulation, right? So his therapy, yeah, when it comes to, okay, fine. I think Alka psychology. Yes, yes. Can you explain these steps briefly? See, actually now, as I told you, when in EMDR therapy, it is an 8-phase therapy. There are 8 phases. In each phase there are different procedures. It is a completely structure wise therapy with a positive cognition and negative cognition and bring the memory and all this, because simply I cannot explain this, because it is actually step 1, step 2, step 3, like that. Because in the first session maybe you will complete only phase 1, and it includes grounding technique, it includes mindfulness, it includes bilateral stimulation, tapping, butterfly hug is like that. So lot of, and eye movement, you will move your eyes finger with eye horizontal or vertical, something like that. So there are eight phases. Each phase have maybe 8 or 10 steps, you understand. So this is a complete therapy, because EMDR therapy, you should understand it, and you should have a structured scripting for that. There is a structured scripting. If I do the EMDR, I gave the complete note to them how they will, and even all my previous batch students are already, they are practicing EMDR. So they actually give me feedback at it worked well and something like that. So if you are confident, you can definitely do it. But I'll give you the complete step-by-step procedure to do that. That is the thing. Bilateral simulation, I told you, 2 different actions: eye movement and bring the memory, or tapping and bring the memory. You understand? So these are the bilateral stimulation normally telling. I hope that Alka, you understand the things like that, because if you want to join in my EMDR, maybe next time when I do, you can even join and learn that how to apply in the client really.
हम्म, ये बिल्कुल सही बात है, और ये एक काफ़ी आई मोमेंट को यूज करके काफ़ी बढ़िया थेरेपी, डिसेंसिटाइजेशन की टेक्निक और रीप्रोसेसिंग की टेक्निक, काफ़ी आई थिंक 7 या 8 के आसपास स्टेप्स आपके पास होंगे इसमें, कई बार इससे ज़्यादा भी। लेकिन इसमें डिसेंसिटाइजेशन काफ़ी इंटरेस्टिंग है, इंस्टॉलेशन करना है वो भी काफ़ी बढ़िया रहता है। बॉडी स्कैनिंग जो कई बार हम लोग दूसरी जेपीएमआर के थ्रू भी करते हैं, तो वो भी इसका एक पार्ट है। और थोड़ा सा मतलब जो क्लोजर वाला सीन है, तो उसमें भी इंस्टॉलेशन को बार बार चेंज करना, पेशेंट का फीडबैक ध्यान में रखते हुए बैक टू बैक प्रेजेंट मोमेंट में लेके आना, ग्राउंडेड फील कराना, कॉपिंग स्ट्रेटजी यूज करना, और बहुत सारे स्टेप इसमें होते हैं। जैसे सर बता रहे हैं कि इसको आपको एक थोड़ा सा सिस्टमेटिक लंबे समय के साथ और लगातार प्रैक्टिस से आप इसे सीख सकते हैं।
Yeah, correct.
जी, और कोई सवाल हो तो प्लीज आप पूछ सकते हैं।
So अभी आपके पास टाइम है, आपको चाहिए तो कुछ क्वेश्चन ऐसा होगा तो क्लैरिटी, कुछ ग्रे एरिया है आपको थोड़ा, यू कैन आस्क मी, एंड आई कैन whatever way I can make it clear, I will make it clear also, no problem.
सर मुझे थोड़ा सा ध्यान आ रहा है कि
Hmm.
आपने मुझे एक मेडिटेशन या गाइडेड कुछ ऐसा बताया था, तो क्या
हाँ,
उसका टाइम है अभी थोड़ा सा हमारे पास, क्योंकि सवाल इतने ज़्यादा नहीं आ रहे अभी हमारे पास, तो हम
हाँ
डायरेक्ट वो स्टेप भी ले सकते हैं और हमारे पास
हाँ,
समय भी
अभी अभी चाहिए तो वो हमको कर सकता है, अभी टाइम है हमारे पास। तो
30
उसको
15
दस
15-20 मिनट तो है।
10-15 मिनट टाइम चाहिए उसमें।
10-15
It's a,
मिनट है सर,
it's
आराम
a
से
type of
आराम
trauma healing guided meditation part. So, but the one time, if you want, I can do it for you now, even in this session also.
श्योर श्योर, बढ़िया रहेगा सर, बहुत बढ़िया
Okay.
रहेगा।
So in that case, actually now I think how many people are there now with me?
यदि मैं यहाँ देखूँ तो करीब 23 के आसपास लोग आपको लाइव यूट्यूब पे
Okay.
सुन रहे हैं, और
Okay.
इससे ज़्यादा मेरे ख्याल से लिंक्डइन का डायरेक्ट नहीं दिखाता है।
Okay.
और कुछ लोग आपको फेसबुक पे भी सुन रहे हैं, तो उनको वहाँ जाके मुझे देखना पड़ेगा।
Okay. Okay.
लेकिन ये है कि
Okay.
ये लाइव
In
बाद में
the,
भी मिलेगा।
yeah, in that case, actually, no problem. We can practice it now. We can practice it and we can do it. Everybody participate with me. Accordingly, this is a guided meditation for trauma healing type, a guided therapy. So you can just, but one time, but anyway, it will be available in PCF website also. Anytime you can listen it also. But you have to do it continuously. One time is nothing going to happen. But definitely, when you do it for repeatedly, then you will get a lot of relief out of that. So that is the technique normally, so we can practice it. So be ready for that. Okay, we will do a guided meditation with me now. This is a trauma healing therapy. Okay, but this guided meditation, as I told you, here you are not going to bring your traumatic memory, because this is a different type. So don't worry about it, because this is a different type, because you are not bringing your trauma experience now in your mind. That this is another type. It's a simple one, like that's what I'm telling. There are certain, most of the even hypnotherapy and even EMDR and all this, you will really experience it and you will bring in your mind, then you will dilute it. But here is not like that. So don't worry about it. Okay. Now just make a comfortable position for you. Whoever there with me, make a comfortable position, either sitting or you can lying down also. Okay, no problem. So sitting in the chair, relaxing is better, and just your hand rest in your lap. And if it feels safe, now gently close your eyes. Gently close your eyes and then take a slow, deep breath in and slowly breathe out. Again, breathe in deeply and exhale completely. Now, allow your breathing to settle into a natural, comfortable rhythm. With every breath, give yourself permission to simply be here. There is nowhere else you need to go, nothing you need to do. This time is entirely for you. And bring your awareness to the points where your body meets the chair, or if you are sitting in a bed or wherever it may be, and feel that your feet is touching your floor, whatever it may be. And notice that in this moment, you are supported, you are held, you are safe enough to be here. As you breathe out, imagine releasing all the tension. Feel the gentle rise and fall of your chest. Feel the rhythm of your breathing. Allow each breath to anchor you in the present moment. And you remind yourself silently in your mind, I am here. I am in the present moment. I am safe right now. Just I am here. I am in the present moment. I am safe right now. Now you imagine a place where you feel completely safe. It may be a real place or an imaginary one. Perhaps a peaceful beach or a forest or a mountain meadow or a beautiful garden or any place where you feel calm and protected. It is your choice. Now, when you are in that place, notice the colors around you, notice all the scenery around you, Notice the sound, what you are hearing. Be with that. Notice the temperature of the air. Take your time exploring this place now. This is your safe place now. This is your safe place. This is your own safe place. A place where healing can happen naturally. A place where you are protected. A place where you are respected. A place where you are loved. And feel yourself becoming more comfortable here. As you rest in this safe place, imagine a warm, healing light appearing nearby. This light may be golden, white, blue, pink, or any color that feels comforting you. The light radiates wisdom, compassion, and understanding. It knows your struggles, it knows your pain, and it comes without judgment, only kindness. Allow this healing light to gently surround you. Feel it wrapping around you like a warm blanket, comforting, protecting, supporting. Notice how your body responds. Allow any tension to soften. Allow your shoulders to relax. Allow your jaw to loosen. Allow your heart to feel supported. Great. Now imagine that this healing light reaches every part of you that has experienced pain. Wherever you feel any pain in your body, you feel that this light is penetrating there and it is completely entering inside you. Now, forcing anything, not rushing anything, simply offering comfort. Imagine the wounded parts of yourself receiving exactly what they need. Perhaps it need understanding, perhaps it need protection, perhaps it need love, perhaps validation, or perhaps care. The healing light gently whispers to you now. The healing light whispers you in your ear. What happened mattered. Your feeling mattered. You deserved care. You deserve healing. You deserve peace. This healing light telling you silently what happened mattered. Your feelings matter. You deserve care. You deserve healing. And you deserve peace. Allow yourself to receive these words repeatedly in your mind. No need to analyze or judge. Just receive it. Just receive it. You need care. You need peace. You need healing. Just listen that. That's great. Wonderful. Imagine that you are carrying a heavy backpack now. Inside are burdens from the past. You feel that you are carrying a backpack on your shoulder. It contains complete burden since years you are carrying, which you don't want, which you are not deserving you, but you are carrying it, unfortunately, unconsciously. It can be fear, it can be shame, it can be guilt, it can be self-criticism, and it can be any pain. You do not need to identify every burden, but simply notice the weight of the bag. It is very heavy for you. Since your life, you are carrying that on your backpack in your shoulder. Now, imagine placing the backpack on the ground now. Release it from you and keep it on the ground. You do not have to carry everything today. You can put down what no longer serve you. Notice the feeling of relief. Notice the space opening with you. Notice your body becoming lighter, lighter, and lighter. And with each exhale, release a little more. With each inhale, receive a little more peace. With exhale, you release the pain or burden. With inhale, you feel more peace and comfort inside. Just feel it. And bring your awareness to your heart now. Notice a small spark of light within your heart. A very small spark. This spark represents your resilience, the part of you that survived. the part of you that continued, the part of you that never gave up. And with each breath, this light grows stronger, brighter, warmer, and steadier. In your center of heart, this light now expands, and you feel it become brighter and stronger and steadier now. And feel this strength spreading throughout your entire body now. Let it spread all over your body, in your chest, your shoulders, your arms, your abdomen, your legs, your feet, everywhere. You are connected to your inner strength now. This is your own inner strength. This is your own inner healing. This is on your own inner healing power. You are strongly connected to that inner healing now. This is you are reconnected to your capacity to heal. Healing does not require perfection. Healing happens one gentle step at a time. Then again, in this very healing relaxation moment, just allow these following words to settle deeply within you. You say in your mind, little loud or silently, I am safe in this moment. I honor my experiences without being defined by them. I am learning to, I deserve compassion and care. My body and mind are learning to heal. I am stronger than I realize. Peace is growing within me. Healing is possible. I am safe in this moment. I am learning to trust myself. I deserve compassion and care. I am stronger than I realize. Peace is growing within me. Healing is possible. Take a moment to absorb these words, this feeling deeply conscious level. All these positive affirmations continuously will heal you in this pleasant atmosphere, pleasant situation, or in your safe place. That's great. Wonderful. Now we will slowly bringing back your awareness, and now just slowly bring awareness to your breathing, gentle rhythm of your inhale and exhale, and just aware your support. Notice the room around you. Take a slow, deep breath in and slowly breathe out, and gently wiggle your fingers, slightly move your toes, and if you want you can little give a stretch of your body, and now carry with you this sense of safety, strength and healing that you have cultivated today in this moment. And when you are ready, gently and slowly open your eyes and come back to the present state of mind. Yes. Yeah. So how, what is the experience? How you feel that?
Right now, sir, I am feeling very light.
Yeah, okay.
वो पीछे जो वजन रखा हुआ था वो साइड में रख के देखा,
Yeah.
तो काफी काफी अच्छा था ये।
Okay. So
काफी रिफ्रेशिंग था। नीचे कमेंट भी हमें अच्छा रिफ्रेशिंग का ही आ रहा है। काफी इंटरेस्टिंग ये था कि बहुत सारी चीज़ों पे इससे पहले ध्यान था। मेरे लैपटॉप में 1 2 3 4 और 3 8 टैब खुले हुए थे। पहले 1 मिनट के बाद मेरी 8 टैब में गायब हो गई। फिर अगले 1 मिनट में ऐसे लगा कि क्या इसके बिना काम चलेगा? फिर उससे अगले मिनट में पता चला कि सब
yeah.
कुछ काम चल ही रहा है, देखते हैं क्या रुकेगा।
So when you practice it actually continuously for some time, basically when you do it by your own with a very isolated place and very comfortable space and all this is slowly. Okay, wonderful, sir. Thank you. Feel it was okay. There are a lot of people telling comments or some. Thank you very much. Anyway, so you have to practice it. It's a single time. Not therapy basically. So single time you cannot heal anything, but you have to practice it, because practice and practice, it will help you to release your trauma whatever way you can do it. So you can listen the audio and you can practice it at least some 21 days, 3 weeks time on in a, then it will be basically very good experience for you, and lot of healing will take will definitely. There is not it's not a, because it is a trauma healing therapy only. It's a light therapy, but here we are not experiencing any trauma, but you are trying to give a positive suggestions or healing suggestions to your mind, and then we are healing it basically. That is the thing. Okay, so
बहुत सारे ही थैंक यू आ रहे हैं, और शायद ये वो पार्ट था सेशन का जो ऐसे बोलते हैं कि बिल्कुल अलग था, लेकिन सच में इसका इम्पैक्ट जो है वो कई बार
yeah.
80% चीज़ों का इम्पैक्ट 20% आता है, और 20% चीज़ों का इम्पैक्ट 80% आता है। तो बहुत सारे कमेंट यार मिल रहे हैं सर,
Yeah,
वंडरफुल, थैंक यू
that's
सो
okay.
मच, राइट।
This is therapy. That's what I plan it, because at least to do something. And because normally in all my webinar or virtual session, always I give a demonstration for either one or two any therapy. Basically, there are a lot of technique like that. So it is basically we can feel it and we can experience it like that, and you can practice it. But anyway, so simply I am telling you, without putting effort on your mind or subconscious mind, you cannot heal anything. So don't think that a psychotherapist can heal you in one session or two sessions. It's not like that. So don't confuse it. But your sincere effort, your sincere effort is needed in that, because that is why normally I used to say in my class also, your success formula is 50% discipline, 25% consistency, 15% mindset, 5% hard work, 5% smart work. So your discipline, consistency, mindset is very important for your success. In whatever way you want to achieve it, you have to practice it, and like that only you can bring the recovery. Like that only you can heal your problem or your emotions or whatever it may be. Otherwise, in one everything like that, don't reject, but don't do any therapy technique, any this one in a judgment way. Don't try to analyze it. You just do it. Maybe 1 day, 2 day, 3 day, you will not get any result, no problem. You just practice it, definitely it will get it. Because when I gave a technique for one client for a mirror exercise, 1 week she was telling me, doctor, I cannot do it, I cannot do it, I hate it, like that. I told, don't, no problem, you just do it like that. Then after the first week, second week, after that, after end of second week, again she called me, and now what she is telling me, doctor, even one single day without doing that exercise, I'm not feeling good. So that is the difference in the subconscious level or unconscious level happens. So when you do it, yes, it will give you result. It's not like that without doing or practicing. That is why Dr. Joseph Murphy also tell the people, somebody asked him, sir, any shortcut to do this mind reprogramming? Then he told, yes, there is a shortcut. Then he asked, okay, tell me please, I want to practice it. Then he told, okay, shortcut is you practice. That is shortcut. There is no any other shortcut. So that is way normally you can heal yourself, because everybody have self-healing power. You
या
believe it or not, I'm telling you, everybody have the subconscious level and you have the self-healing power. Only thing you have to identify your inner strength, you have to explore your inner power, you have to explore your inner healing power, then you can definitely heal it.
Yeah, that's great, sir. And there are a couple of thank you for your session.
Yeah.
So I think it was also wonderful. मुझे बहुत कुछ सीखने को मिला, और सर का ये दूसरा वेबिनार था। मैं सर को बहुत बहुत थैंक यू भी करता हूँ। सर हिप्नोसिस के मामले में बहुत टाइम से काम कर रहे हैं। मैंने उन्हें देखा भी है, इन सब ऑनलाइन ही चीज़ों में मैंने उन्हें देखा है। तो मैं आप सभी को सजेस्ट भी करूँगा कि इफ़ यू वुड लाइक some these kind of things which is related to the therapeutic intervention, you can directly connect.
So anyway, I just want to tell everybody, if anybody wants to know more about me, you can go to www.chittadhara.com. That is my website. And you can go to that website, www.chittadhara.com. Or otherwise, You can even directly connected with me WhatsApp. You can get my number from Raj also. If anybody want anything help or anything like that, anytime, always you are welcome. Because no problem. You can contact me that because you can get my number, or you can go to my website and you can directly connected with me through the website also, through WhatsApp also. That is it.
सो अब समय हो गया है अलविदा लेने का। आपका बहुत बहुत सर हम शुक्रिया करना
Thank you.
चाहेंगे।
Thank you very much for Raj and all other participants who joined here, because I really enjoyed this, because this is my second webinar to you. But okay, so even now the first two webinars sometimes I used to listen again because
ओके
basically,
ओके।
so like that it is there. So everybody please. So I, because first of all I want to really appreciate you because you are doing a great job. You are definitely helping people in this through this PCF and lot of webinar, and that also free webinar you are giving with the different subjects, OCD and all these things. Because I have seen sometimes I joined also in some webinar when I am free, but most of the time you are 7 p.m. Normally I have today I didn't take session because for the webinar. Okay,
या
I
आई
postponed it
कैन
tomorrow.
अंडरस्टैंड द
Okay.
हेक्टिक
Yeah, that
बिजी
is why
स्केड्यूल।
actually. Thank you very much once again inviting me second time. So anyway, so hope
सो
everything is.
थैंक यू सो मच। जो साथी बाद में सुन रहे हैं या अभी सुन रहे हैं, मैं उन्हें कहूँगा कि वो हमारा सहयोग कर सकते हैं इस वीडियो को दूसरे लोगों तक भेज के, ताकि लोग अवेयर हों, उन तक चीज़ें पहुँचें। और सर की एक्सपर्टाइज, यदि आपको 14 साल का एक्सपीरियंस 1 घंटे में सुनना है तो मैं कहूँगा ज़रूर इस वीडियो को वो देखें। और जो भी साथी इस वेबिनार का सर्टिफिकेट क्लेम करना चाहते हैं तो वो सब लोग भी क्लेम कर सकते हैं। मैं आप सभी को बताना चाहूँगा कि ये आप वेबिनार देखने के लिए पूरा फ्री है, कोई इसका चार्ज वगैरह नहीं रहता है। सर का मैं बहुत बहुत धन्यवाद करता हूँ। और साथ के साथ मैं कहना चाहूँगा कि अभी तक इतने लंबे समय तक आप हमारे साथ बने हुए हैं, मैं इस बात को बड़ी बात मानता हूँ। क्योंकि आज रील का 10 सेकंड का टाइम भी इंसान को इस तरीके से बात करता है कि नहीं काम कर रहा तो अगला स्क्रॉल कर देते हैं। इंटरनेट के साथ भी इतना जल्दी चीज़ें हो जाती हैं। सो आपका बहुत बहुत शुक्रिया, थैंक यू सो मच। और यदि इस सेशन से आपको कुछ सीखने को मिला है तो ज़रूर दूसरे लोगों को शेयर भी कीजिए, और हमें भी काफ़ी अच्छा लगेगा, हमारा यही पर्पज़ है। सो थैंक यू सो मच एंड थैंक यू सो मच डॉक्टर साहब। जल्द ही फिर किसी दिन आपका समय लेंगे, कुछ महीनों बाद, कुछ साल बाद। तब तक के लिए खुश रहिए, खुशियाँ बांटते रहिए। थैंक यू सो मच।
Thank you. Thank you.